In the continuation of infectious disease of medicine, today I am going to discuss the dengue fever. So what is dengue fever? Dengue fever, it is a viral infection which is caused by dengue virus, right? So dengue fever, it is caused by dengue virus. Basically, dengue virus is RNA virus of a genus filovirus. Now, how it is transmitted? So, dengue fever, it is transmitted by Aedes aegypti. So, dengue fever, it is transmitted by Aedes aegypti. Aedes aegypti have a characteristic white and black spots over it. So, how the patient is presented with dengue fever? So, what are the presentations of dengue fever? So, we divide it into 4 stages. So, there are 4 stages for the clinical presentations. The first stage is called as dengue without warning signs. That is called as dengue without warning signs. The second stage is dengue with warning signs. Dengue with warning signs. The third stage is called as dengue hemorrhagic fever. Dengue hemorrhagic fever, and the fourth stage is dengue shock syndrome. But it is not like that every patient of dengue undergoes all these phases. Always keep in mind the majority of dengue fever patients, they fall in stage 1, right? The majority of dengue patients, they fall in stage 1. But if the patient gets severely immunocompromised, in that condition, the patient may progress from stage 1 to stage 4. What is the incubation period? What is the incubation period of first stage? That is 4 to 10 days. If a patient is infected with dengue, so up to 10 days there will be no symptoms, but after 10 days the patient began to develop symptoms. So what are the clinical presentations? In dengue, in first stage, there will be high grade fever. There will be high grade fever up to 40 degrees centigrade, plus there is star criteria. In first stage, there will be high grade fever and star criteria. So there are 5 important features. Upon all those features, at least the first 2 features must be fulfilled. There will be severe headache, right? And the most important is there will be history of retroorbital pain. So that will be the pain around the eyes. Also, there will be severe arthralgia or myalgia. And because of this, it is also called as breakbone fever. It is also called as breakbone fever. It will be maculopapular exanthum and enlarged lymph nodes. So I repeat, in the first stage, there will be high grade fever associated with the severe headache, retroorbital pain, severe arthralgia or myalgia, maculopapular exanthum, and the most important is that the rashes which is developed in dengue, that rashes are called as a blanchable rash. A blanchable rash means that when you applied pressure on the body of skin, so the rash will get disappear. So there will be blanching rash, and there will be enlarged lymph nodes. So at least 2 or more than 2 criteria must be fulfilled in the star criteria along with the fever. Now, in the stage 1, when patient recovered from the phase 1, so these patients usually they have a white spot on their body. Mainly when these patients recover So they have a white spots on their body along with red skin, and that is called as island of white in a sea of red, and it is classically associated with pruritus. So when these patients recover from stage 1, they have a white spots on their body along with the skin is get red, and that is called as island of white in a sea of red. Now the second most important point regarding stage 1 is that they have a positive capillary fragility test. They have a positive capillary fragility test. Now, what does it mean? When you applied BP cuff over the patient arm, then you have to check the BP. If the BP was, let's say, 120 by 100, then you have to take the mid of that reading, like 100. You have to keep inflated BP cuff up to 100 mm Hg for 5 minutes. You have to wait for 5 minutes, and after 5 minutes, you will have to see that whether how many particular hemorrhages are there. If the particular hemorrhage is more than 10, so that will be the classical positive capillary fragility. So as fever subsided, so there will be the start of warning signs. So again, the warning sign consists of a star criteria. Warning signs consist of star criteria. These patients will come to you and they will give you a typical history that I have a abdominal pain. There will be persistent vomiting. There will be enlarged liver. The liver is so enlarged up to more than 2 centimeters. Fourth is the fluid is leaking up to third space. So these patients will presented with ascites or pleural effusion. Increased level of hematocrit and decreased level of platelet. The star criteria is abdominal pain, persistent vomiting, and enlarged liver more than 2 centimeter, and the fluid is leaking up to third span. There is increased level of hematocrit and decreased level of platelet. Third stage is dengue hemorrhagic fever. So what does it mean? Actually, these patients are already affected by dengue virus. So the same patient get affected by the different serotype of Aedes aegypti, which lead to the lethal infection. I mean to say, these patients, they are infected with the two different strain and serotypes of Aedes aegypti. So these patients are more susceptible for lethal infection, right? So these patient will comes with the second spike fever. So these patient will come to you with a second spike fever. Along with that, there will be dengue hemorrhagic manifestation. Dengue hemorrhagic manifestation means this patient comes to you with the petechiae, purpura, ecchymosis, thrombocytopenia. So these are all the dengue hemorrhagic manifestations. Dengue shock syndrome. And dengue shock syndrome, the patient is already presented with dengue hemorrhagic fever plus, if there is dengue hemorrhagic fever plus shock, so that is lead to dengue shock syndrome. Shock means this patient will have decreased BP and all the vitals they are going down. Let's talk about investigations. The first is serological test. The first approach is serological test, and serological test there is ELISA used to detect IgM. So in serological test, we have to do ELISA, that is used to detect the IgM antibody against the Aedes aegypti. While the second is, that is NAT, and that is used for the viral antigen. It is used for viral antigen. But the most important test regarding dengue fever, that is NS1 antigen. NS1 antigen. Now what is NS1 antigen? This NS1 antigen, it predicts the dengue non-structure protein 1. So it's important, the NS1 antigen, it is for dengue non-structural protein 1, and when we can do the NS1 antigen test, we will do an NS1 antigen test within the 7 days of appearance of symptoms. NS1 antigen, it is performed within 7 days of acute symptoms. So what are the things that we don't need to do? We do not need to prescribe the corticosteroids. So we do not need to prescribe the corticosteroids. Why it is so? As it leads to immunosuppression, hyperglycemia, and GI bleed. Do not give platelet transfusion if the platelet level is low, as it precipitates the fluid overload. Do not assume that IV fluids are necessary. Do not assume that IV fluids are necessary, as fluids, as capillary fluids are leaking, so it leads to fluid overdose. Do not taken the normal saline. So do not taken the normal saline and 0.5%. What are the things which have to perform in dengue? The first of all, it's important that we should recognize the critical period. So where the symptoms begin to appear. To monitor the fluid intake and outtake as well, and vital signs. Now let's talk about the treatment option and stepwise in each of the stage of dengue fever. Like if we talk about the stage 1, and stage 1, if the patient is presented with fever, so in that condition you have to give paracetamol. You can do coarse spongings. In order to prevent the dehydration, you can give ORS as well, and some juices. If the patient is presented with the fever, then you can prescribe paracetamol and you can advise cold sponging. If in order to prevent dehydration, you can give ORS and certain juices as well. Now in stage 2, the hospital admission is important. Hospital admission to check the hematocrit level. Crystallites. You can give the isotonic crystallites, but this isotonic crystallites, it is given in a step down pattern. If we talk about in stage 3, and stage 3, the emergency treatment is given. All fluids as well. We can give control fluids. And in stage 4, we can give the isotonic crystallites, colloid bolus, ml per kg in 15 minutes. So that's all about the day.